started at Westside 28 years ago. We were a small operation in the Adams 4 Shopping Center, 2 exam room office with 3 employees. Westside was having a hard time getting started and getting known in the community, and it was started really by a group of volunteer nurses who had identified a need for culturally competent and linguistically adequate care to the Hispanic community of the west side of Wilmington. Over the last 30 years, Westside has grown to who we are today, which is a community health system of 5 health center locations in Newcastle and Kent counties, and a mobile health unit that travels from Kent County and western Sussex County, serving the agricultural worker, farm worker communities of Delaware. So essentially we're now serving people statewide.
We are set up to see patients who have difficulty navigating the healthcare system. Makes it much easier to do my job. I love that we have language support for patients that makes it smooth, and that we have social service coordinators who can help patients get the help that they need.
I've been a patient of Westside from day one, when they first opened their facility at Adams 4. Me and my 3 children, we were the first patients. They provide good quality care. You know, they're very, very caring people. We have a lot of people here that do care about the patients.
I think we've made a huge impact on the community throughout our state, and an impact on the health care of total populations. That's being done by providing easy access to quality and affordable health care.
The reason why we're here is because we're able to help. And then that's what is most important, so I think that the patients appreciate that.
Westside has people there who can help them get the resources they need in order to access the health care.
We want to make sure that we're providing the services in a manner that is good for the people that we're serving. If you don't have transportation, that hinders you. That's a barrier from you getting health care.
It's not just the nurse practitioner or the physician interacting with the patient. We also have financial counselors to help patients to maximize their ability to obtain care. We provide dental services. Oral health is increasingly recognized as being integral to the entire health of the individual.
We have expanded our care teams so that we can address all the needs of our patients in a holistic way. We also are able to offer sort of one-stop shopping for our patients to make sure that, say if they come for their primary care, they can also get their medications at an affordable price. They can also get their lab studies at an affordable cost as well.
The community really feels like Westside makes a big difference. Our patients really appreciate having a place to come that they feel welcome, having a place to come that they feel understood, that they feel listened to. You know, we've been here at 4th Street, we've been here for a long time, so are really integrated as part of the community.
Well, in the community, I mean, they're just happy that they're able to come to a facility where they can communicate with people and understand them.
Well, I think that it's great to be here, you know. As I said, I came many years ago. I was a dental assistant when I did my training in the West Coast, and then I came back. And then I came back because Westside planted that seed in my heart and said, and then many years later, that seed was growing, and then that was what I'm here.
I think I just want to say that I really love what I do. You know, I love being here. I love getting to interact with the patients that I see. I love the feeling of connecting with someone, and I really get to do that here at Westside.
So we have the ability to touch people's lives in a very positive, meaningful way that will allow them to continue to carry out their lives in a normal fashion, or as normal as possible, considering some of the circumstances that the farm workers or the local community residents have to go through.
And I could choose any other facility, but I mean, Westside has and has continued to provide my needs and my family. So I just hope that they're around for a long, long time to do the same for other families.
In 30 years, we'll be expanded a lot bigger than what we are now, providing these services to everybody who needs it.
To me, seeing how the dental department it's been growing in the last couple of years, and then the ideas that I have in my mind and where do I want the department to be in the future is what keeps me running. It's what makes me come in every day and say, I don't want this just to be a one-day situation. I want this to become the dental home for many of our patients.
But Westside has come a long way, and it will grow and grow and grow and grow and grow. I believe that.
I really think that working on building the depth of our relationships with our patients, making sure that we can make those lasting relationships with patients and their families, that they that they continue to see Westside as a place to go, and that we can start to integrate services to take care of more of their needs.
I think Westside has a absolute key role in the community, and I think the future is bright for the next 30 years.
Just to continue to be able to provide, access and quality health care to underserved communities, that would be my dream of the future of Westside, and the legacy that I'm so proud to be able to share in this 30-year celebration.